It's almost like the stars are aligned. It's a perfect time right now. The appetite for change is there. There's sufficient, I suppose if you would look at it financially, we're in a place where we need to think it through, come up with new alternatives, new ideas. And it's unfortunate, but human nature is where there's crisis or where there's constraint. That's when some of our best ideas come forward. The healthcare system of the future and of the present, we're hoping that the types of changes that we're looking at aren't about cost cutting, but rather looking at value, and value from the patient's perspective. Being able to identify what adds value, what would be viewed as waste, to be able to strip the waste from the system, to be able to obviously maximize value and provide a far better system, far better care. Probably the most important thing is that the agenda is quality. And we believe inherently that you can improve quality and reduce cost both at the same time, which is something very different from what we went through in the 80s and 90s. Well, the system itself has been very much provider-centric. We didn't set out to do this, but over time it's evolved to be very much to our convenience rather than to reflect the patient. And in part, a lot of what we've kind of the way we've approached things is to think of the patient almost as if they're a problem in our day when they're our only reason for being. With the health system, it's dissimilar to most industries where they would look at the patient, the client, the consumer, the customer as being the center of everything we do. We need to be careful because we have a tendency to have flavors of the day or the month, a tendency to think that this too shall pass. This is so fundamental in terms of the redesign of the system. We need to make sure we're talking to real people, real patients. We need to make sure that we're not institutionalizing like we do everything else. That voice, we need to keep it fresh and we need to keep it front and center. What we've found, the big shift in the work we've been doing in Saskatchewan is to have the patient right there. And when you think about it, most industries, their approach with the customer is something kind of nebulous out there, someone who you might sell a product to. But in the service sector, particularly in healthcare, it's important to keep in mind that the patient is right there. We don't have to speak of them in esoteric terms or theoretical terms. Just ask them, how are you doing? Is there anything more we can do for you? Invite them in. They're more than willing because they feel a real sense of ownership in terms of the health system and the work that we're doing. Well, it's interesting. We've taken a look at the health system, and we've actually looked right across the globe. Many jurisdictions have. Ontario has, Saskatchewan has, others. And we don't see a system that has adopted high quality, but we have these pockets of excellence. And if anything, in terms of the Council of Federation work, we found these huge opportunities to learn from pockets of excellence and see if we can take those learnings and spread them. Now, the work that's being done here allows a platform for sharing. And as unfortunate as it is, we just don't do a good enough job in this country of sharing our best practice. Worse yet, we seem to think the answers are out there somewhere, elusive, and they're right in front of us.